we talked about, Dr. Rajini talked about welfare and welfare measures, and Dr. Thiagarajan also, underscored the importance of welfare and investment in human resources. And do you think, and he also said this is because, the people and their attitudes, the social, do you think it is a social demand which is common to all the 5 South Indian states, which somehow propels this kind of a governance model?
Sir, basically there are 3 parts. One is the governance, development, and welfare. In this aspect, as a government, as the time has passed now, we are not living in a isolated situation. It is not just one state. We are now competing with the entire world. It is the best what matters. It is not the numbers. So probably in this direction, it is a time for us to not look at only short-term gains. It should be more of long-term gains. As we are talking about education, for example, if you are talking about education, the numbers, now we are not talking about the numbers, we have to talk about the quality. The quality matters. The quality, since the entire 21st century, it is about the knowledge-based economy, the innovation, the technology, which is going to play, already it's playing a crucial role. Probably in this direction, the quality, if you look at each state, the number of quality institutions, what we are now created are the existing one, in what levels they've been running, existing, it's really questionable. So probably the money being spent by the governments for probably government school, people are not looking up. So the very existence, the community school, the government school existence, it's become with regard to the quality aspect, it's become questionable because of no option, no other way. Some people just get into it. So the declining standards has led to the deterioration, degradation of the entire society. For us to see a promising future, since already post-independence, we have completed 75 years, probably in next 25 years, we are going to celebrate the centenary. So what is our benchmarking? How we need to go forward? We need to be basically an enabler and a facilitator, but keeping in mind where we are, what we are supposed to do. So probably in this direction, we need to really focus and build a right kind of framework. We need to build a right kind of framework which is going to enable for all these things to be achieved. Probably it's a matter of, the health cannot be just defined only in a health setup. Health has got a wide parameter, education, probably the quality levels, small numbers. Even though with the similar existing system, the 10% of the student, even without a guru, they can learn better. So probably they are more of Ekalavya than a guru, Dronacharya, they don't depend much. So probably we need to, since working as an higher education minister, ITBT in science and technology.
You need to translate that also.
Yeah, as a skill development minister, we have seen the aspects, what really needs to be done. Probably in this direction, we came out with a lot of reforms during our tenure to be more of an enabler to ensure how we can get the best of the best out of the students and get the real good teaching and learning transformative changes and making use of the technology, the demand and supply. So the real, many of us don't know the real blue collar or the white collar, what kind of jobs are available, what one person needs to learn. It's not just only for qualification, how he's going to build his livelihood, what is it all about, where is his passion, skilling, technology, all this integration, right kind of inward looking, outward looking and enabling should be done. So probably we need to work a lot to be the best in the world. So we're still very far to catch up. Probably investing on education can address all the challenges, whatever society is been facing with regard to all the issues, let it be from environment to all the social, economical, all the aspects, whatever society has been facing, all the problems can be addressed very strongly by providing a right kind of education. Probably we need to emphasize more because individual empowerment can happen through a right education and skill development and integration of technology. This is what I can say. Probably to address the poverty, sustainability, economic progress, healthcare. For all the verticals can be addressed only through right prioritizing the education only, can only bring, even if you spend lakhs together crores in any of the sector, you will not get the dividends.
So can we take it that in the southern model of governance, importance, priority to education and investment in human resources, I mean, some people call it welfareism or welfare, whatever, but let's call this investment in human resources, investment in people, in women, in children, in education. These things take priority. Sri Dinesh, what do you think? I mean, is it that the governments are giving priority to these areas, or is it the electorate which is demanding these? Is it from bottoms up, or is it from top down?
See, the human resource is the biggest resource that this country has got. Now, if we don't turn a human resource into a strong resource, then this country is going to suffer, because the numbers are so high. And ultimately, our aim should be to see that every human becomes an asset. So, of course, good health, good education, right policies to enable the person to achieve his potential, to his capability. That should be the aim of government's policies. So it's easy to say, but difficult to do. But our policies, I feel, if you look at it across the southern states, has been always in, the human welfare, which directly contributes to the health, education, and growth of that person and the family. So I think in that sense, most of the southern states have been focusing, when it comes to schemes, whether it is a midday meal program, whether it is free education, whether it is free education for the girl child, whether it's the Stree Shakti or the self-help groups, which have took up in a big way in Andhra and then Karnataka and many states. All these things are adding up. It can't just be one thing which will just say, okay, I differ with Ashwath Narayan when he says, let's put everything in education. Education is needed, but along with that, you need that ecosystem to grow. The entire system has to, you can't just put money into education and expect everything to happen by doing it in a one particular manner. So the overall concept, I think, has been there in our states. And if you look at Karnataka also, we were among the first states in the late 70s, early 80s that opened up education for private sector, medical, engineering, technical. So, that indirectly contributed to the state becoming a IT capital, now Silicon Valley, whatever, all that. So, our investment should be to see that the human potential develops, and each person can achieve to his maximum capability. So, our schemes and our programs, I think, has come about also. One is from our side, from the government or from the elected representatives doing it, but also at the same time, I think there's been a lot of pressure on the government from movements, from citizen movements, citizen activism, and people demanding for rights. I think there's been a more free space for the people. I do not know how. I don't want to compare it to other states, or say in the north or in other regions.
We don't have to. We don't have to.
But I'm saying in our regions, people have demanded. And whether it's a farmer, whether it's a laborer, they have demanded that we want this and we need this. And whichever government has done that effectively has been rewarded. Yeah. So there has been that cause and effect that has happened. So I think it's been both ways. One is our governments also and our political leaders have also invested in welfare schemes. That welfare in terms of human resource, education, health, everything, and women empowerment. And at the same time, the people also have been active. And also there have been some good reform movements here in the South. You had people who have been very progressive in the ideas, whether it is Periyar or whether it is Narayan Guru, whether it is Basveshwara in Karnataka, all of them are, very progressive, different thoughts. So these different thoughts opens up people's minds, It gives them that you can question things.
It challenges the existing,
It challenges.
existing order. Yes.
The existing model. And I think even our political models have been competitive. There's a competition between political parties to come to power, to get into administration. So when the competition is more intense, then I think the delivery becomes better. And the approach to see that it's people-centric, like what Ashwath Narayan also was saying, people-centric. What is the interest of the people? How do we, do good for them? Of course, some people may criticize saying it as Revdi culture and all that, but that is for them to say. But for us, we have reaped the benefits of that Revdi culture. We are seeing the benefits. So I think it's a two-way. The people, and of course, the government comes from where? It comes from the people. So we are their representatives ultimately. So it's a two-way thing.
So it's both bottoms up as well as the top down. Dr. Thiaga.
Maybe I'll just add one more nuance to that. I think when the levels of education were very low, when people were not as informed, when the mass communication channels didn't exist, it was probably more top-down. It was probably both in administration as well as in social revolution, as Gundu pointed out, with the social justice revolutions, the self-respect movements, and many, many such movements. But it's, I think, a truism across all societies that as people get more educated, more aware, more connected, they start expecting their rights and their benefits to be provided by the state. So it probably started off with some visionary people driving revolutionary change, but it's probably now, at least in Tamil Nadu, if I look back 100 years, 70 of those 100 years, some self-professed Dravidian party has run the government, and the remaining 30 years, some version of a Congress government whose policies and values in Tamil Nadu differed significantly from the national policies, I'm saying in the 30s, 40s, pre-independence, and immediately after independence, enough to be different for a southern model compared to the rest of India's model. So it probably started off much more from the top. Right now, it's definitely from the bottom. We all, as my colleague said, we're elected by the people, we deliver what we think they ask for and what they want.
So it reflects in the governance model that is emerging. And Ashwath ji, what are the other distinguishing features that one can list as far as the southern model of governance is concerned? Okay, one is investment in human resources, education, so-called welfareism, etc. And then what? In terms of political culture, the way we elect the representatives, the way we throw up issues, the way we resolve issues, the way we consult generally in the southern states, the functioning of the legislatures.
This is the era of digitalization, sir. How best we can simplify, because the governance has to be on their tip of their finger. Not at the doorstep of a person, now it's on the tip of the finger. Probably in this direction, even the government expenditure can be cut down probably by 75%. Probably even the resource, even in the government machinery, it can cut down, it can become more effective, it can be more sustainable. It can be very sustainable, accountable, transparent, efficient, to address all the challenges, whatever the people have been expecting. All those things can be delivered to get more into e-governance. Governance is there. Only thing we need to integrate the technology. Already the framework, probably if you compare 10 years before or now, if you look at the numbers, so the net availability, the smartphones, among the people, it has grown in a very big way. Probably it is now very easy now, the time is very ripe to take us to forward. And COVID has shown us how we need to build even the smaller towns, smaller villages. This is a way forward. Now the present trend of having bigger cities cannot sustain, because it is not sustainable now. For us, the way forward is to strengthen the smaller towns, smaller villages to become more prosperous, to get them all kind of facility availability can be ensured. This is the future model, because there's no other model. This is the way forward to prevent the migration of the people. Relocation should be prevented, and ensuring the quality of living irrespective of where they live, by making use of the technology and bringing more of accountability. And in the public life, as you know very well, sir, it is degrading. Day by day, it has been degrading. It is more of how to lure the people, how to win over, in what are the methods. There's no rule in election. So elections, winning elections, there's no rules and regulation, though there are many regulations. In every day we keep getting new regulations. Even then, we try to, there's nothing unfair in election and law. So that's how the things have been going on. But as a society, lot of awareness. See, awareness is more about creating lot of awareness among the people. People also need to get lot of awareness and understand what is their rights, privileges, what needs to be done, and their involvement, their participation is the most important thing. Whatever I've seen, being a part of a government during the 4 years of my tenure, I could see these are the most important things which needs to be prioritized. Being more accountable, transparent, getting technology in governance is most important thing. This will lead to more simplification, and government should become more of an enabler and a facilitator than getting into all the areas and
in your mind,
justifying.
In your mind, the southern model of governance has technology as one of the most important elements.
Yes, sir.
Okay. Dinesh ji.
I think technology as a model of governance is not just for South. I think it's for all the states.
More pronounced here.
I think maybe we are more adept at picking up technology and using it to our benefit, and being, in terms of using technology to help in our education, in the health sector, and having all the tech industries in our regions. And so all these are contributing. But I think tech is the way forward for the entire country, the world. And the earlier that we start adapting them and using them to our benefit, I think there are so many things that can be done today using technology, which can really improve our delivery system, transparency, all that. So definitely tech is the way forward. And I think Karnataka, we are in a state where I think technological companies are, all the top tech companies are in Karnataka. So we are looking at ways, say in my department, health department, we are looking at ways of how we can use AI to diagnose, to be able to get the best specialist person to be able to connect to the lowest
virtually
at the primary health center level, at the village level. So these are things that we are looking at very seriously, and there's no doubt about this. It's a no-brainer to say that tech is part of governance, and the entire country is using it to be able to monitor, to see how things are going, whether the programs are being implemented, is it reaching the ground. So, and of course, South, the advantage that we have is we are better placed to make use of it.
More access to technology.
Yeah, at a faster pace. Yeah. I think that head start we have.
Yeah, I would add to that of course the education level and the penetration. So, if I want to go e-governance, I must have citizens who are capable of availing of e-governance. So if they're better educated, slightly better off economically, and therefore have access to smartphones and internet, service, then it makes our job easier. So these are, I think, ancillary benefits that come from having better human development and better economic development is that the leveraging of technology becomes much more effective in terms of making government efficient. I would agree at a broad level that across the country and even in the south,
Much more pronounced maybe in South.
yeah, but the state spends too much money perpetuating itself. I say that as a former finance minister. In every way, the state perpetuates itself disproportionately.
As they say, the state is the necessary evil.
So I think there's a lot of room. But I would also pick up on a point Dinesh Gundu made earlier. Part of our unique model might be our continuous global outlook, right? I think the southern parts of India have been seafaring and trading back to the days of the Roman Empire and very much more multicultural and international in our outlook. And so it's a very difficult separation to make. If you look at economic outcomes or human development outcomes or even social development outcomes, there are 2 or 3 inflection points, right? Whatever the gaps were at independence were not that high. Around the 60s, they started to get a bit higher. And the real turning point came after liberalization. And liberalization really allowed those states, and those were the southern states, that had already invested heavily in human capital, in education and health, to get the benefits of a more global, more integrated into the world economy kind of growth trajectory. And the separation really took off. So I think partly it was because of our outlook.
More prepared they were.
Yeah, partly because when these things come, always those who are better equipped end up benefiting a lot more from those who are less well equipped.
Rajini, Dr. Dinesh already mentioned about infusion of technology into medical services. You preside over medical education, health and medical services in your state. Say Andhra Pradesh and generally the southern states, the model of governance, reliance on artificial intelligence and technology, the cutting edge of technology in medical services, in giving access to medical services to the poorer sections of the population. How is that in your mind? What kind of a role does that play in defining the southern model of governance, in your experience?
Certainly, sir. When we blend technology into the health sector, a predominant change in the health sector is found. When I talk about the state of Andhra Pradesh, infusing technology, and by the use of technology, we can see tremendous change in the health sector. For example, if I could quote, like, every state is trying to digitalize all the health records. So in our state, likewise, we take all the data and we try to digitalize into the electronic health records. So in terms, when I talk about electronic health records, for this, our Honorable Chief Minister has rolled out a great initiative in the state of Andhra Pradesh. That is a family doctor program. So this program basically focuses on every individual, every household, and every village, providing quality and affordable healthcare right at their doorsteps. So with this, what exactly happens is we are able to provide quality healthcare services to all the rural, remote areas, even covering the far-flung areas, and also especially focusing on the tribal areas. So when you're focusing on these areas, it is very important for us to have the data of every individual with the government to understand their health needs, and also in order to give efficient treatment and the referral, and also to have the whole chain of custody of that particular individual and his data. So for this, what we exactly do is not only offering treatment, not only giving him best qualitative services at free of cost from the government, but we also make sure the data is properly captured on that particular name by having an ABA ID or by having a proper ID. And all his health ailments or all his prescriptions, treatment, and all his labs and investigation, all those reports are stored. Imagine if there is no technology and we don't have any proper source to save in a proper format. Can we imagine, like, let's take an example of a situation. Like if an individual, unfortunate thing, but I'm quoting this as an example. Imagine if somebody met with an accident somewhere and immediately he needs blood within span of an hour or maybe less than that. So imagine if there is no health record of him and we are not using digital, if we are not in the era of digitalization. It is a situation where the patient needs immediate attention, and when his blood group and which group he's belonged to and none of his whereabouts are unknown. So it is hard for someone to tackle this kind of situation. Imagine if he has an idea or if he has some database somewhere, it is easy for a doctor or it is easy anywhere in the state to access his information. And if you are immediately knowing his blood group and all, it is very easy for a doctor to understand and get him that particular, organize or arrange that particular blood for him. And immediately they can start with the treatment. And if he has maybe BP or sugar or something else, if it is some reactions for some medication is there, if this profile is accessible and if one can understand at one click anywhere in the state or anywhere, so it is easy for them to treat him and save his life in less time. So likewise, digitalization is playing a very important role, and it is this data-driven approach is really a very important thing, playing an important role in every government and everywhere in the world. So we, in the state of Andhra Pradesh, and we are the pioneers in digitalization, and we have received many recognitions and awards in maintaining the digital health records in the state of Andhra Pradesh. So I believe any government, for any of its great initiatives, if an added advantage with the use of this technology is going to make every approach a very successful approach.
Thank you.
Thank you.